Hi everyone, I wanted to give an introduction to health and happiness and the science behind my thought patterns and my practices and some of my research. I really want you to be able to investigate these things on your own. Is it flaky belief or science? In my classes, my books, my Facebook pages, you're going to see that I talk about some things that may cause some people to have pause and to stop and think a bit. But it's things that I've used in my own practice with gaining health and for my business. You may look questionably at some of my ideas, and when you hear me talk, and you may think I'm some hippie new age person that's sending you off into a world of crazy. But there is a lot of research, and I'm going to cite what I learn and what I practice in a lot of my work that I post on the Facebook group and in my writings, because I want you to research it yourself, and I want you to find out what works for you. It's not my job to persuade you. I just want to give you the information, and then you could try it for yourself and see if it works. Now, let's start with Qi. Is Qi real? There's a division of the National Institute for Health, the NIH, called the National Center for Complementary and Integrative Health. Their goal has been to conduct and support research and provide information about complementary health products and practices. So if you're in doubt about a practice that I talk about or something else that someone says to you, the National Center for Complementary and Alternative Medicine is an excellent place to go get it checked out. So the whole thing started with this is because I wanted to do a video on a practice that I use called Dragon and Tiger Qigong. It's medical Qigong, and I've been doing it for years, and I believe it really helps me. But as I spoke some of the things out loud, I thought, I'm not sure I believe myself talking about this. It just sounds so weird to say them out loud. And that's the reason why I decided to write all this down and to do this practice basics so that people knew what my thought patterns were. Easy to talk. So what is Qi? It's not easy to talk about Tai Chi, Qigong, even meditation or those type of things without talking about Qi. And basically, Qi translates to breath or life, and it's in everything. It's in the yard, it's in all the things. That's what the traditional Chinese medicine believes, and it flows through our body. If it doesn't flow, we're in trouble. So if you have stagnant Qi or blockages, then that gets you sick. So when we do Dragon and Tiger Qigong, it helps to keep the Qi flowing. And so you would wonder, so you have to wonder, is there science behind Qi? Now, I have to say this, that science hasn't been able to quantify Qi, to see Qi, or to understand why Qi works. But science has come to the realization that things like acupuncture work, and they can't explain it, but they know it works. So for me, I don't have to understand how it works. I just believe that it does work, and that is something to know as well. There's a really big word called Psychoneuroimmunology. I was so excited when I found this out back in the 80s, and I couldn't believe that more doctors didn't know it. But basically, the idea behind psychoneuroimmunology is that our nervous system can affect our immune system. And that made perfect sense to me, but doctors weren't on board on that. So, because even doctors will say, when you're stressed, it increases your chance for heart disease or diabetes or that type of thing. So they understand this relationship now. There is also a group called the Psychoneuroimmunology Research Society, and you can find them on the internet. And their practice is an international organization for researchers in a number of scientific and medical disciplines, including psychology, neuroscience, immunology, pharmacology, psychiatry, behavioral medicine, infectious disease, endocrinology, rheumatology, and those who are interested in interactions between the nervous system and the immune system and the relationship between behavior and health. So when I'm telling you about these things, I have incorporated a lot of them into my own life, and that's why I'm sharing it with you. Now there's another term called mind-body, and mind-body is the belief that your thoughts, your emotions, and a lot of other things can affect your body. And this stuff just blows me away when I research it, when I read about it. I'm just so excited about it. So that means that some of your ill health can actually be caused by some of your thought patterns, or some of your belief system, or some of your subconscious thoughts that you aren't even conscious of. So when you're paying attention to mind body, you're also paying attention to psychoneuroimmunology and alternative medicine and complementary medicine and integrative medicine. Now, what are those three things? Well, they're all a little bit different, and I found this wonderful overview of integrative, complementary, and alternative medicine by Dennis Milstein, and I'll put that up so that you can check it out. So complementary medicine refers to non-mainstream practices used together with conventional medicine. Alternative medicine refers to non-mainstream practices used instead of conventional medicine. And integrative medicine is healthcare that uses all appropriate therapeutic approaches, conventional and non-mainstream, within a framework that focuses on health, the therapeutic relationship, and the whole person. Now, if I had to describe what I do, I would assume, and I would say that I do integrative medicine. If you're really lucky, you may be able to find a doctor that works with integrative medicine, or a hospital. A lot of hospitals are taking the approach of integrative medicine, and they're including things like Tai Chi or Qigong or acupuncture or meditation in with the practice of helping their patients deal with cancer or lung disease or that type of thing. So it's been very, very interesting to see the hospitals pull this in when it's been, I just kind of go, wait, where you been? Where you been? Now, there's no doubt that using alternative medicine can be very risky, and I would like to put a caution in here. If you don't know what you're doing, for example, some people hear that taking calcium will increase bone strength, but if you take too much calcium, you can be constipated, or you can get kidney stones, and sometimes vitamins can interfere with the medicine that you're taking. So you really have to know what you're doing. Even the things that you eat, like you could eat grapefruit. Did you know that grapefruit can sometimes increase the potency of a medicine? So here you are eating this healthy grapefruit and taking medicine, and you don't know. So you really have to be your own advocate. You have to actually put yourself in that role, which seems very excruciating and extra stuff, because if you're sick or you're dealing with something, then you also have to do this. But I find it liberating. I find it empowering. Because we think of doctors as gods, and they're not. They're just human beings. And as a friend once told me, they don't call it practicing medicine for anything. I mean, they are practicing medicine. So you are the person that cares the most about what's happening with you, and I encourage you to explore that. Okay, so you've listened to all this and you're going, well, I don't really think that I believe all that stuff. And I can understand that, yes. But I would also say that there may be something underlying, a subconscious belief system or something within yourself that is keeping you from believing it. So let's look at those things. For example, the placebo effect. We all know about the placebo effect. They give some patients sugar pills, and some patients the actual medicine. And what happens? Some people on the sugar pills actually get better because they think it's the real medicine. So that's a really profound thing, because it's telling me that you're tricking your mind into believing that is real medicine and it's helping you. So then you wonder, can you still get better if you know it's a sugar pill? Well, there is a study, and I'll show it to you here. Also, hold on to that idea, because if you have an element where you've been told that it's going to continue to get worse, or if you have something that keeps you getting sick on a regular basis, you have triggers, you don't know what they are, there's a really good chance, just because you know that it's going to perpetuate, or you know it's going to keep coming, that your brain is actually making it happen. So how do you get past this? How do I get past my subconscious? And I've worked with a lot of different ways, and I'll give you a lot of different tools and a lot of different resources, and you can check them out yourself, but it's just fascinating. And also there's a nocebo effect. Basically what that means is that those people who took the sugar pill and knew about the side effects of the drug, they ended up getting the side effects. Now, this was a biological thing. the doctors looked and they did get the actual side effects. They had all the physiology that said that they were having a reaction to a drug that they were never taking. So what does that tell you? That means that the brain has much more capacity than we give it credit for. And I think there's a really big key in trying to feel healthier, get healthier, and be happier. I'm gonna talk about the subconscious and give you some research for the subconscious and talk about different tools to use with the subconscious. But the reason why I'm doing that is because it can not only affect your health, it can help affect your relationships, it can affect your business. It goes very deep in how the subconscious can affect your life. And here's the thing. If you're reading this or you're listening to this and you say, wait a minute, are you telling me I'm making myself sick? It kind of goes with the same idea of prayer. When people pray for you and you feel like you're not getting any better, then you feel shame, like I did not believe well enough, or I wasn't working hard enough, and they're absolutely, shame is contrary to getting healthy. So take shame out of the equation. It's not there. You're going to do the very best that you can in these things that you learn, in these tools that you learn. And I can almost guarantee that you're going to feel better, but let's see what it does for you. And I can't wait to hear what people say about these things that they try. Tell me. Find me on the Breathing in Life and Happiness Facebook group, the private group, and let me know that these things are working. I know that they have for me. They have saved my life. That's it in a nutshell. Some things may work for you, some things may not. I encourage everybody to work with caution. I encourage everyone to work with a doctor. Everybody is responsible for their own health, and these are suggestions. Of course, I have to say my legal description. I will say that the content I write or post about is for information and educational purposes only and does not substitute for professional medical attention. So that is my disclaimer. Do this at your own risk. I feel, in my experience, I have worked with both doctors and alternative medicines. And I have to say a couple times that I turned away the doctors and just did the alternative medicines, I got myself in trouble. And so walk cautiously, explore a lot, do a lot of research, do your study, and become your own advocate. And consider it a fun job. Like, it's someone that you really, really love, and you want to make them healthier. And you are there to support them and encourage them and do whatever you need to get them through what they're going through. So I look forward to sharing with you some more, and thank you so much for allowing me this time to share with you and to discuss some of these things. I'll cite my information on the pages and in the articles. Thank you very much.